Hi guys, welcome back to Codemaster Coach, your medical coding tutor. We're continuing our CPC review studies of the chapter on radiology. Okay guys, so I'm here to answer the 3 questions from yesterday, and I have additional questions on radiology for you today. If you have not been following my series on this CPC review and these questions, and I'm hearing from you guys who are taking your CPC exam and you're saying you're seeing these very same questions on the CPC exam. So again, this is a study that we're doing to prepare for the CPC review. So let's see how well you did on yesterday's 3 questions, as well as I'll have some questions for you today. All right, on yesterday I asked, a screening examination is performed when? And the answer is there are no signs or symptoms, but the provider is looking for a specific disease or illness. A screening examination is performed when there are no signs or symptoms, but the provider is looking for a specific disease or illness. Second question that I ask you. To code radiological services correctly, a coder should be able to, and it's A, recognize the type of radiology equipment, B, determine which equipment is used for the evaluation, and C, understand the applicable guidelines in the radiology section. Okay, I said a code. In order to code radiological services correctly, a coder should be able to, it's A, B, and C. Recognize the type of radiology equipment, determine which equipment is used for the evaluation, and understand the applicable guidelines to the radiology section. And then the third question I asked on yesterday, supervision and interpretation, S&I, describes the supervision and interpretation of the radiological exam or procedure. Okay? S&I describes supervision and interpretation of a radiological procedure. All right, your questions for today. The 3 routes for contrast material include, and I'm asking you to identify all that apply, intravascularly, intra-articularly, intrathecally, or intradynamically. The 3 routes for contrast material include intravascularly, intra-articularly, intrathecally, or intradynamically. And when the anatomic location has been identified, codes for radiological examination by X-ray often are selected based on, is it A, the number of views, B, the number of films used, C, the number of limbs, or D, was S&I involved? When the anatomic location has been identified, codes for radiological examination by X-ray often are selected based on, is it the number of views, the number of films used, the number of limbs, or was S&I involved? All right, guys, answer these questions, and I'll be back tomorrow with the answer as well as 3 additional questions for you. Thanks, guys. I'll see you in the next one.